Are you struggling with your gut health? Probably have IBS and just don't know. You've seen all the doctors, all the specialists. You're upset, you're frustrated, you don't know because they just tell you it's all in your head, or it's just that, you're fine. You've run all the tests, all the blood work, and everything's fine, but you just know you're not because you're still having digestive issues. You're getting gas and bloating, you're having abdominal pain, you happen to have the runs or constipation. You just don't know what to do about it. So I'm going to talk to you about how basically what I suggest with all my patients, and I see lots of digestive patients, and I'm going to talk about that right after this intro. Hey everybody, I'm Dr. LeGrand. Welcome to Nature's Health Clinic, this channel where we talk all about basically health when it comes to basically a lot of these things that come, especially digestive health, as far as hormone imbalance. We talk about fasting as well. We talk about other health topics that we do cover at my practice at Nature's Health Clinic. So today we're going to talk about how to actually improve your gut health. And these are things that I, see all the time with patients coming in for a lot of digestive issues, and they have seen all the specialists, and then they come see me. And the big reason is because conventional medicine, when it comes to chronic digestive issues, it's really lacking. Usually it's either a medication, or they just tell you, you have IBS, and that's just what it is. In fact, I just had a patient a couple days ago. That's exactly what the doctor told her. Said, well, you have IBS. There's nothing much we can do about it. There actually is. There's a lot you can do. The problem is, in the conventional medical school, we get one course, or at least in the conventional, I went through naturopathic medical school where we really dive deep into nutrition, alternative medicine, but also conventional medicine. We kind of use both Eastern and Western medicine to more of a holistic approach. So what I always suggest with my patients as I'm working with them, the biggest thing is, of course, looking at the deficiencies and the biochemical imbalances in the body. Now that's something that I do in my own practice here, but these are the things that I always find constantly happening with my patients that have digestive issues. And the very first thing that I do recommend that a lot of my digestive patients who tend to be more sensitive, and I grew up with IBS, and so I know the pain when it comes to digestive issues. And when I did this, and when my patients start doing this, it does make a pretty big difference. And that is trying to separate your fruits, your sugars away from your main course meals. And why, you might be asking, why is that important? Well, because with fruits and sugars, we tend to our body processes that really fast. And with our main course meals, usually you're going to have some protein, and protein our body processes at a slower pace. So when you have those two extremes colliding, it can make a battle in our stomach system and really cause the runs or gassing and bloating. So try that. Try to separate, basically taking your fruits and your sugars away from your main course meals. Okay, makes a big difference. That was my big thing with my IBS, because I used to like drinking orange juice or apple juice, or have an apple or an orange or some kind of fruit with my main course meals, and I always would have explosive diarrhea and wouldn't know why that was an issue until I started doing this. And then I started using it with my patients, and then all of a sudden they were starting to get better by doing it. The second thing is keeping your liquids away from your main course meal. Now, especially if you have acid reflux a lot, or also known as heartburn, this can be a big difference too. Also, if you have, lower stomach pain, that tends to be an issue when you are drinking too many liquids along with your main course meal. We live in a society where you're supposed to have a drink with your main meal, but when you have a very sensitive stomach, you need as much as stomach acidity to help break down your foods. And if you're drinking water or beverage, it kind of waters that down, makes it a little difficult to break it down. Try to keep your liquids away from your main course meal. I would say at least 10 minutes away. So, you can have a little bit before your main course meal, but not during. The third thing that I suggest is using digestive enzymes or pancreatic enzymes, because the pancreas produces digestive enzymes, but as we get older, this becomes an issue. Our pancreas isn't producing as much digestive enzymes, and that's the second thing that's so important when it comes to breaking down your foods. You first have the stomach acidity, then you have the enzymes that break down each macronutrient. So you have one enzyme for proteins, one for fats, one for carbs, and so using a digestive enzyme can be really helpful in trying to actually digest your foods. I usually recommend taking one after each meal, and that can be really helpful. The fourth thing, and you probably have heard of this one, is probiotics. Now, I say with probiotics, if you've in the last 2 years have taken antibiotics, you definitely need to replenish your gut flora with probiotics, and that's where it can cause digestive issues. Now, on top of that, with probiotics, if that is the case, so you've taken iron box in the last 2 years, you need to take about 25 to 35 billion. People usually will get like 5 billion or 10 billion. That's not enough. I would say between 25 to 35 billion is what you should be taking daily. By taking this helps replenish the gut flora so that you have good bacteria that's breaking down foods, helping what it needs to be doing in the body, in the digestive system consistently. The fifth thing, this is really helpful for a lot of my digestive patients, but there's a caveat here. If you've ever heard of HCL, or also I use Betaine HCL and pepsin, which Betaine and pepsin are an actual enzyme that help with inflammation in the gut. HCL is something that our stomach is supposed to produce. Actually, our pancreas helps with that, is hydrochloric acid, HCL. So basically, HCL is what is produced in our stomach to help break down our foods. And sometimes that can be low. Now, if you tend to be very acidic, you have very high stomach acidity, taking HCL could cause more heartburn. But in a lot of cases, I find that people's stomach acidity is low, especially for people who have digestive issues. So it's something you should probably check before you start taking HCL. But if you suspect you tend to be in that category where you don't produce enough stomach acidity, then HCL, like a Betaine pepsin HCL, can be really helpful in breaking down your foods and also reducing the inflammation in the digestive system, reducing gassing and bloating and abdominal pain. The sixth thing is bitter herbs. Bitter herbs are so important when it comes to actually our digestive health. Why? Because bitters actually produce naturally enzymes throughout our digestive tract system. Because it's bitter, it actually stimulates those enzymes. It also stimulates the liver and gallbladder, which is also important when it comes to digestion because the gallbladder helps with also processing our fats. The liver also is connected after we've eaten our foods, go through our liver system, detoxifying it through all. So it's really important to be able to take some bitter herbs. And bitter herbs are like things like dandelion. Dandelion root is a very common one that you can actually take, and you can get in liquid form and then take it before each meal. The seventh and final thing, this was common, is eating a more whole foods diet. Trying to eat more good vegetables, plenty of vegetables, as well as proteins and healthy fats, but more whole foods. What does that mean? What does whole foods diet mean? It means trying to shop on the outside of the grocery and not in the middle lanes where everything's packaged. So when you're shopping on the outside, you're getting fresh meat, you're getting fresh fruits that aren't packaged. That's a whole foods diet. So if you're shopping more on the outside, that's considered a whole foods diet. You start shopping in the middle lanes, everything's packaged and processed. That's not a whole foods diet. So the more you can do that, your body doesn't have to process all these weird chemicals that are in these types of foods. So if you have a sensitive stomach and you just don't know why, it's possible because you're eating too many packaged food stuff and not enough whole foods. Because you think about our ancestry, they didn't deal with all this process and these new chemicals that are, invented by food scientists to make things taste better, to process things and have them last longer. So when our body is introduced to it, they don't know what to do with it. And so that's what happens with digestive issues. But if you actually stick with what our ancestry have been used to, our genetics, eating things that are just one ingredient, a banana, broccoli, thing of meat, one ingredient, more whole foods. Now, when you cook it all together with spices and stuff, there's more ingredients, but it's still foods that your body, your digestive system recognize. That's what you need to start doing. So I hope you found these tips helpful. If you are new here, go ahead and subscribe to our channel. We talk all about health topics as well as fasting on this channel. So you can hit the subscribe button, as well as hit the bell notification button, as well as give us a thumbs up if you like this video. Until next time, this is Dr. LeGrand signing out here at Nature's Health Clinic. And until next time, I will see you in the next video. Thanks. Bye.